podcast, one and all. My name is Varun. I hope you're all doing well. Once again, we thank you a lot for supporting us and also sharing these very important video podcasts which are health related to all your families and friends. Please continue to do so because these are some very important topics that we are bringing in for the benefit of our society, for the benefit of the world. With some, top doctors, they have been taking the time of their busy schedule and sharing these important details with us, especially related to our health. So, with that said, the topic we want to discuss today is very, very important. Please be cautious. This is diabetes and kidney damage. How are they both related? How is that actually going to affect our overall health? So we have Dr. Sujeet Kumar joining from Wisconsin, United States of America. He has 14 years of experience in nephrology as a subject, as well as a kidney expert. So welcome, Dr. Sujeet, sir. How are you doing?
Pretty good. Thank you, Varun.
Great. Dr. Sujit, sir, as you have just heard, we want to ask you some important questions around diabetes and kidney damage. So, though these are two vital organs, I mean, one of them is a vital organ, and another one is the most common disease that you can find around the world, especially in a country like India. So, the first section of the question is we want to firstly understand how does diabetes affect a kidney?
Yes, yeah, very, very important question. And India is considered actually the diabetes capital of the world, uh, with about 100 million people with diabetes or pre-diabetes in the country right now.
Oh my God.
Uh, and diabetes is the number one cause of kidney failure worldwide, including India. So,
Wow.
the burden of disease is immense, and it's vital that we control the source, which is diabetes, to prevent kidney failure. So, the most important thing with diabetes, type 1 and type 2, is to take good care of your blood sugar to prevent any complications. So, controlling blood sugar and maintaining your glycohemoglobin to 6.5 to 7 is the most important thing in preventing kidney damage.
Okay, okay. But I mean, the numbers that you just mentioned are alarming, Dr. Sujit. So most likely, majority of the people in India might be having diabetes or pre-diabetic conditions. So does that mean that everyone has a kidney disease, or how do one identify those who are diabetic that they have a kidney disease?
Okay. Yeah. So about the numbers are about 70 million people in India have diabetes.
Oh my God.
And uh, every patient with diabetes does not have kidney disease. So there's only a very small fraction with diabetes which will have kidney disease. So but the disease burden is so much that even if you have 10%, then you'll have 7 million people with kidney problems. So to determine and to diagnose, you need to check their kidney function, and you also need to check their protein in the urine at least once a year to diagnose any evidence of early kidney disease in these patients.
Okay, sir, let's now talk about some prevention and management about these kidney diseases from diabetes. So, how can one do that? Can they really do it? Can they really prevent their diabetes affecting their vital organ, which is the kidney?
Absolutely. And the three big measures are, as we discussed, number one is you need to control the source, which is diabetes. So you need to control your blood sugar. Number two is control of high blood pressure in these patients. And number three, as I discussed, people who have protein leaking out in the urine, they need to be on a medication to prevent the protein leak.
Okay, okay. Sir, this is one common word we have been hearing very commonly, which is called diabetes kidney disease. So, I believe the relation between them is something that you just mentioned to us. Are there any different stages, like cancer, stages, yeah, for this DKD, which is diabetic kidney disease?
Absolutely. The first and the earliest stage is called microalbuminuria, which means presence of microscopic amounts of albumin in the urine. And that's stage 1. So every diabetic have to be tested for that at least once a year. And after that, your stage is dependent on how much kidney function is left. So less than 15% is stage 5, 15 to 29% is 4, 30 to 59% is stage 3, and between 60 to 90% is about stage 4, stage 1. So, so there are 5 stages of kidney disease: 1, 2, 3, and 5. 1 is the earliest, where there is only protein leak, and that has to be picked up early to start treatment.
Right. So how does one know that they have this diabetic kidney disease, sir? What are some diagnoses, or how is it monitored?
Yeah, so there are two very simple tests. One is called a urine protein or microalbumin, and the second test is a blood test called serum creatinine, which is your
Okay.
kidney function.
Okay. Okay. And how about medications or treatments in order to slow down this DKD, sir? I mean, which is diabetic kidney disease, or can we completely get cured from this diabetic kidney disease?
So, yeah, if you're in stage 1 with only protein leak, that is completely reversible. If you take good care of your diabetes and high blood pressure, and you use the medication we discussed to prevent protein leak, this is curable. Uh,
Okay. Okay.
and very advanced stages like 3, 4, and 5, they are not curable, but you can slow down the progress of the disease process.
Right, right. Now let's quickly talk about some advanced stages and some treatment options available for them, sir. So when might dialysis be needed for someone with the kidney diabetes kidney failure?
Yeah. So when you're in stage 5, when your kidney function is less than 15%, and you start having symptoms like severe itching, very poor appetite, severe swelling all over the body, or if your potassium level is too high, that is called uremia. And that's when dialysis is needed and started.
Okay, okay. Sir, everyone has heard about diabetes, sir. But are there any different types of diabetes? Can you explain us how it works?
Yeah, there are two main types of diabetes. One is type 1, and the other one is type 2. And generally, type 1 is if you get affected in early stages of life, where basically you have very little insulin in the body. So the treatment is insulin. In type
Okay,
2, you still have insulin in your body, but it's not released appropriately, or it's not enough. So that can be
okay.
treated with either tablets or insulin or some other newer medications.
Okay, okay, got it, sir. Sir, let's say, for an example, in the advanced stages, how does one know, that they, the person who requires a kidney transplantation if they have diabetes?
So yeah, I mean, if your kidney function is less than 15%, you're having
Okay,
symptoms, or you're on dialysis, those people have to be evaluated for kidney transplant. And if they are healthy enough and have a donor, they can get a kidney transplant.
okay, okay. Sir, you mentioned about dialysis, right? Dialysis is again a common word that we have been hearing in a lot of multi-speciality hospitals, and every street household there is one person who's undergoing a dialysis process. So, is dialysis also done commonly around the world in one process, or are there any different ways dialysis is performed? Sir, can you please throw some light on that?
Absolutely. Yeah. Dialysis is actually a life saving procedure. And there are two types of dialysis. One is called blood dialysis or hemodialysis. The other one is called the peritoneal dialysis, where you have a tube in the belly where you put water, which is a clean water with sugar, and that does the cleaning part. So that's called peritoneal dialysis, which is actually quite common in India, not as common in United States. The In United States, the most common is hemodialysis, where you need to clean the blood. So you get the blood out, clean it in the machine, and then the blood is put back in the body.
Right. So this is again a common question. This may be the most stupid question which anyone can ask. When you're talking about a dialysis machine takes blood out of our body, cleans it and puts it back. Will that person not die? Because if there is no blood in the body?
Yeah, but it doesn't take the whole blood at one go. So there's a blood flow rate about 400 mils per minute. So you take a little bit of the blood, clean it, and then put it back. And the cleaning device is actually a filter, which is
Okay.
actually a very small filter, which takes out all the toxins and gets back the clean blood back into the body.
Right, right. Sir, let's say, a person has to go through this kidney transplantation, right? So, can you explain us what are the risks and benefits of the kidney transplantation for someone with diabetes?
Oh yes, yes. So see, the main reason why people get a kidney transplant is because people who are on dialysis have a very high chances of dying, and the mortality is about 15 to 20%. Sort of 100, 15 or 20
Oh my,
will die every year,
oh my God. Okay.
and transplanting them actually improves their survival. So that is why there is a big push to transplant these patients if they are eligible. So that's number one. Number two is, of course, when you get a transplant, you don't have to be hooked to a machine. You don't have to go to dialysis 3 times a week and spend a lot of time, you know, on the machine in a center. So that those are the advantages why you need a kidney transplant and why you should get one if possible.
Right, right. Dr. Sujit, there is this question. Probably this will actually increase the morale as well as the confidence in those people who are dilly-dallying around whether they should get a transplantation or stick to dialysis or let go and let it be, let the nature take their own course of time or whatever the decision and all. What are some advancements that are happening in the research side, especially for treating diabetes kidney diseases?
Okay, so diabetes kidney disease has been there for many years, but in the last 3 or 4 years, there are some new medications which have come out, and they are known by the name of SGLT2 inhibitor. And they have some common names here called Farxiga or Jardiance. Those actually are known to slow down the progression of kidney disease. Uh,
Okay.
there are also newer medications like Ozempic and Manjaro. Those are weight loss injections once a week, which have shown to reduce your weight by a lot. And by reducing your weight, actually, you can cure diabetes.
Okay. Okay.
Just like bariatric surgery or people who undergo surgery to kind of staple their stomach or bypass their stomach and they lose a lot of weight, that can actually cure your diabetes.
Oh, okay. Wonderful. Dr. Sujit, one last question, before we end this session, sir. So for those people, because we have been, or especially the families who has a kidney transplantation patient, they get these suggestions from different people. Doctors say get a dialysis done or get a transplantation done, but there is again a risk. You need to be closely monitored. You are prone for infections. There will be tubes that will be attached to your body. You have to go through some medications for a very long time. Vagera vagera. I'm talking about a
Yep,
lot of
yep,
things.
yep, I agree.
So some of them feel that it is an expensive task. And some of them feel that, hey, why should I go through this? Why should we put this patient through a lot of trouble, and let the nature take a call? So what is the suggestion that you want to give for these people who are in a confused state of mind, especially who are suffering with these kidney diseases?
Yes, I think that is very important to understand that although we have dialysis and we have transplantation, it is not for everybody. You know, if you're in poor health and if you're very elderly, dialysis may not be a good option for you. So there are trials done in people in the 70s and actually in the 80-year-old who do dialysis, and their actually quality of life is not good. So,
Okay.
but if you're a younger patient in the 40s, 50s, and even 60s, dialysis is life saving. So every patient has to be evaluated, and the risks and benefit explained dialysis versus not dialysis, because It's important to understand that when you need dialysis, dialysis is life saving, because without it, your survival is only 2 to 3 weeks. Uh,
Oh,
so you have to have a discussion with your family member, and do you want to do it long term, and with a future goal of getting a kidney transplantation. So it's an important discussion which every family member should have with their patients.
okay. So this last question again, I've been saying this as the last question, but then again, for those patients or for those families, a lot of them have this fear of undergoing a surgery or even getting an injection done, a needle injection done. Is dialysis process painful to the patient?
So yeah, it's a good question. Now, as I said, dialysis is of two types. One is blood dialysis, and the other one is belly dialysis. So there is certain amount of pain involved with dialysis. Like if you do the blood dialysis, you have to stick a needle in the hand of a patient which has veins. So that will be painful. But after you stick the needle, you may have some cramping or other things, but generally it's a painless procedure.
Okay, okay, glad. Wonderful. So I believe all our audience, this is some important information Dr. Sujit has shared with us, especially related to diabetes kidney disease. So all of you be strong enough. There is a lot of medical help as well as moral help that is available, as well as financial help is also available in our market. So do reach out to us if you have any questions. You have our website displayed on the screen now, which is www.medicasapp.com. You can also download Medicas app from Play Store or App Store. We will connect you with the right parties. We will get you the right help you need for you to make a meaningful decision in terms of what is right for your family as well as for the patient. Dr. Sujit, thank you once again, sir, for taking the time out of your busy schedule. This is an important subject, and you have actually built a lot of courage in a lot of patients as well as the families that have been going through these kinds of kidney related diseases. So please continue to do the good job that you have been doing, sir. We are all very happy and proud of you being an Indian. Once again, thank you so much, Dr. Sujit. We will reconnect again. Namaste, sir.
Thank you, Varun. It's been my pleasure.
Great.